Okay, and we'll go ahead and begin. So welcome. Thank you, everybody, for coming. My name is Sean Holler, and I'm a health educator with the Great Plains Tribal Leaders Health Board. Welcome to our community health webinar series. Very pleased to have everybody here with us today. And it's a great topic, and I think it's a great time of season to be talking about smoke-free health through the power of policy. A lot of things going on right now, and this is just a really good topic to cover right now. And so I have with us Hudson and a few of his colleagues along with us from the Public Health Law Center that we're very happy to be with us today. And we're going to focus on three main topics. So we're talking about the environmental and public health impacts of electronic cigarettes and leadership among tribal governments in dealing with that vaping epidemic that is going on right now. Also, we'll be talking about overall commercial tobacco control policy options that are available to all those tribal communities, including smoke-free standards and prohibitions on the sales of certain products. And then lastly, we'll be talking about just some more information on the Public Health Law Center and their resources and how they can help you and your community of which you serve. And I think this is, like I say, this is something that hits home with everybody. And I was just in another tribal tobacco training this week, and a lot of the things that people that work with tobacco, a lot of the pushback that they get from a lot of other organizations or just some of their community in general is why tobacco? There's so many other issues that are more powerful. And the best way that we can kind of battle that talk is to, bring awareness to the fact that cigarettes or tobacco products kills more people every year than all of those other comorbidities combined. More than smoking, or excuse me, smoking, more than alcohol, more than any other kind of other drug abuse, more than murder, suicides, car accidents, any other comorbidity. Tobacco trumps all of them. And so the reason why tobacco is such an important product or discussion topic is because it impacts everybody and everything. And it really is kind of like a gateway sort of substance that it kind of leads to some of these other bad decisions. And so without further ado, that's kind of why we're here today. Very pleased to be here with Hudson and his team. And I'm just very thankful for this. So I'll hand it off to Hudson and his team. Thank you very much. Go right ahead, Hudson.
All right. Thank you very much, Sean. Thank you, everyone, for having us here today. As Sean said, my name is Hudson Kingston. I'm here on behalf of the Public Health Law Center. You'll also see my colleagues, Colin Welker and Mike Freiberg, who were great enough to come and join me. And we're all here to answer any questions you might have and sort of talk more about what the Public Health Law Center is able to do in terms of providing free legal technical assistance on any sort of policies that you want to work on that promote public health. Right now, I'm going to do sort of a presentation using a PowerPoint, and we'll pause after each topic to sort of talk about any questions you might have. And then by the end, I'll do a more formal invitation of Colin and Mike to introduce themselves too. And we can definitely hold questions to the end if anything bubbles up in your mind over time. But be sure to ask whatever questions you have. We're all here to sort of monitor what you're thinking and what you submit as questions, and deal with that. So I'm going to just start sharing my screen. Sean, can you give me a thumbs up? Is it looking good? Okay, that's the right page. Okay, so as Sean said, the name of this presentation is Smoke-Free Health Through the Power of Policy. And I'm going to be covering three things, talking about vaping waste and the vaping epidemic, policy options that are available to tribal organizations and tribes, and the technical assistance that the Public Health Law Center is able to provide and the individualized help that we can give. As already covered, my name is Hudson Kingston. I'm a staff attorney at the Public Health Law Center, and I'll be doing most of the talking today, but I have other folks on my team here, and we have sort of an internal team that focuses on tribal public health across the different areas that we cover. So we're really excited and grateful to be invited by the board to talk to you all today. The Public Health Law Center is located at the Mitchell Hamlin School of Law. It's existed for about 21 years, and we acknowledge that the Public Health Law Center sits on the traditional current and future homelands of the Dakota people. I want to emphasize that we acknowledge that, especially working in commercial tobacco control there and in law, there's a lot to be made up for. We have to work with tribal communities and help them achieve their goals, because otherwise there's such a deficit and so much trauma that has been inflicted by the law that we'll never get to the public health goals that we want to get to. So we are really grateful for being allowed to speak to you, and we very much want to work with you to achieve your types of goals. This is because everything we do is sort of in a web of different social determinants of health. As Sean was saying, tobacco can be seen as the worst offender, but I mean, there are many issues that communities are dealing with, you know, the remnants of colonialism, the differences of language and social issues, racism, you know, even things like having family members in the military can impact people's views on the world and whether this is important work or not. And we know that we have to not only acknowledge, but you know, sort of communicate with those different identities that people have in order to meet them where they're at. And we're excited to do so. Chief among these considerations is the difference between commercial tobacco and traditional tobacco. So during my presentation today, if I slip up and just say the word tobacco, please recognize that I'm talking about commercial tobacco, an industrial crop that's grown to produce products that are generally bad for people and meant to addict new users to products that are not in no way beneficial to them. On the other hand, obviously, you all know that traditional tobacco, it does not have those negative consequences for society, the environment, or individuals. And we as an organization in no way want to undercut the use or celebration of traditional tobacco. So that's just sort of a baseline thing that we try to be very clear on. Aside from all of that, I just want to also use this sort of visual to emphasize that we view all of our work through a health equity lens. And as a result, we don't think that there's a one size fits all approach to getting health equity. It's very clear that certain policies work for wealthy communities in urban areas, and other policies might work better for low-income communities in rural areas. And we want to be able to adapt to those realities. We're certainly not going to try to force anything on anybody who's not interested in a particular policy that we think is nifty. Okay, so with all of that said, here's my first topic, talking about the vaping epidemic and its environmental impacts. As you know, back in 2018, the Surgeon General declared youth vaping to be an epidemic. And this was based on the fact that, you know, the youth vaping rate had exploded by more than 70% over the course of 1 year. You know, the youth vaping rate at high schools was around 25%. Most of the gains that had been made in decreasing tobacco and nicotine, commercial tobacco and nicotine use among young people had been basically erased over the course of a few short years. So even under the Trump administration, this was viewed as an epidemic, and it has continued to be so. Even though we've had a pandemic in the meantime, even in June of this year, the acting FDA commissioner was testifying to Congress about the ongoing epidemic. So this has not stopped just because there's been other things in the news. It certainly has continued to be the case that young people and new people are becoming addicted to nicotine products. At the same time, and especially in 2019, there was something called the e-cigarette or vaping use associated lung injury problem that EVALI is for short, was infecting people and basically ripping their lungs apart from the inside out. this was in part tied back to vitamin E acetate, but there were a lot of victims and some deaths that were attributed to just people who were only using nicotine products, not necessarily the marijuana products that got a lot of the blame for it. At the end of the CDC's counting, there were at least 2,807 hospitalizations because of EVALI and 68 deaths. And I'm just reminding you of this because it was pretty big news back in 2019, even though again we moved on. It does seem like vaping was on the top of people's minds for a while. And at the same time, it was revealed to us that companies like Juul were explicitly targeting tribal communities. First, this came out in testimony by Ray O'Leary before Congress, talking about her experiences of the tribe where she worked, being approached by Juul and being offered $600,000 to sort of hawk their products and collect data from their members. But then in 2020, there was more proof and documentation that Juul had attempted to do this with 8 separate tribes and had reached out to an additional group of unnamed tribes, but more they had reached out to who did not respond to them. On that topic, I just want to quickly divert you guys. I'll be providing these slides to you after the fact, and there's an embedded link here for our publication on exactly this topic, which provides some model language if the tribe you work with would be interested in doing a resolution that would combat this sort of targeting specifically by tribes. But yeah, as we know, the vaping industry has gone after Native communities throughout the continent, throughout the United States. And tribes were very quick to respond. They used their powers, their inherent powers, to do both temporary and permanent prohibitions on the sale of e-cigarette products. So we saw a couple of temporary policies as listed here, and then more permanent by some tribes, including those in the Great Plains, including the Ogallala Sioux and the Turtle Mountain Band of Chippewa, who both put in place permanent prohibitions on the sale of e-cigarettes. Importantly, these tribes did a really good job of striking the balance of saying that these products cannot be sold on tribal lands anymore, but they did not punish people for using them necessarily, something that we've found generally stigmatizes people, but it doesn't actually help them to quit, especially when they're addicted to something as insidious as nicotine e-cigarettes. So this is just a really good example of not only decisive tribal action, but really quick tribal action. We were tracking this in 2019, 2020, and a lot of tribes moved much faster than states or local governments to remedy this problem during the EVALI crisis. So the question I think arose in my mind, and perhaps is arising in yours. All of this was a huge social and public health toll, but are e-cigarettes harmful to the environment? And just to tell you about these pictures on the left, those are e-cigarettes that I've picked up in my own neighborhood. And this other one was found on a playground in Omaha, Nebraska. So they are starting to show up everywhere where people are using them. And the question is, are they bad for the environment? The answer is yes. So ever since the 1980s, nicotine has been listed as one of the worst kinds of hazardous waste because it is a very deadly pesticide. It had been used for more than 100 years as an insecticide. It's very good at killing and repelling insects. E-cigarette devices, the little tiny electronics with the big battery in them, are also a type of hazardous waste called universal waste. And that's because they both contain heavy metals, but they also have the high likelihood that they'll explode and light on fire. So they cause untold damage, and lithium ion battery fires, burn down recycling facilities every month. And they burn garbage trucks every week, I've heard in reading industry document, or industry reporting on the topic. It's sort of an existential threat to the waste hauling industry. And that's because these things are hazardous waste. So that was back in 1980, nicotine was added to the list of hazardous wastes because it was a pesticide. And in 2019, the tobacco industry asked the EPA under the Trump administration to remove e-liquids from that listing. And even the EPA at that time said no. It said that nicotine is still very toxic. There was no evidence to the contrary proven. And because the FDA has not certified any of these products as safe and has not put any limits on the strength of these products, the EPA said that the liquids would continue to be treated as hazardous waste when disposed of. The EPA did change a few of the rules, which is that sort of perversely made it easier for tobacco retailers to comply with hazardous waste laws, but they did not extend that to schools or courthouses or other public institutions that would be collecting this waste from young people or confiscating it from people who shouldn't be bringing it into the area. So really, when your institutions, especially schools, are collecting these things from young people, they still have to comply with pretty difficult and costly hazardous waste laws just to make sure that these things are disposed of correctly. And tribes do have authority broadly over environmental regulation, and they can set stringent waste management standards. They could act swiftly to address these issues from commercial tobacco products. For example, they could pass the costs that are being incurred by schools back to the retailers that are providing the products to young people. It's a model that I'm very excited about seeing sometime. It's the idea that hazardous waste costs are significant and they really should be borne by the responsible party, and that would be the businesses that make the money off of selling these products. Tribes under the federal hazardous waste laws, under federal environmental laws, there's something called treatment as a state. And the tribes that you work with might have treatment as a state under the Clean Water Act or the Clean Air Act, where they can set their own water quality standards and things like that. That doesn't exist in hazardous waste law, but that doesn't mean that the tribes can't do very creative and helpful things in setting just waste standards instead of setting new hazardous waste standards. And we should also acknowledge that e-cigarettes are not the only the only commercial tobacco products that cause environmental harm. Cigarette butts are the most littered item on the planet. 6 trillion of them are littered every year, and a significant number are being littered in your community every year. Those things are fairly toxic. They've soaked up thousands of chemicals and a large amount of nicotine, which, as we've discussed, is a very dangerous pesticide. Similar to cigarette butts, little cigar tips are frequently littered, and because they're made of hard plastic, they're very pervasive in the environment. They float down streams and into lakes and are unrecyclable plastic. And then product packaging and lighters are frequently littered. As I was talking about just before this started with Sean, tribes on the West Coast have furthered some innovative messaging around this sort of thing, and they've produced a lot of YouTube videos about how vaping is incompatible with their culture and traditions, and also there are some materials about how they harm the environment too. So I think Sean was going to add those links in the chat, but they're also linked to on this PDF, which we'll be sharing with you afterwards. And I think correctly that we are at the first breaking point, because I'm about to talk about policy solutions. So I'm just going to check the chat to see about questions. Okay, there are no questions right now, so I'm going to keep on talking, and you guys let me know if there's anything that pops into your heads question-wise. Okay, so now we're going to talk about tribes policy solutions. I'm going to talk about 3 different things. Obviously, at the Public Health Law Center, we have lots of ideas. We have lots of model policies that we'd love to talk to you, but I'm going to limit what I'm talking about right now to 3 different types of policies. First, commercial tobacco-free and smoke-free policies. Then we're going to go talking about tobacco retail licensing and how that helps to facilitate sales restrictions on commercial tobacco products. And then I want to talk about additional authorities and perspectives that are unique to tribal communities and how they might be able to exert their special powers on the issues of commercial tobacco control. Okay, so commercial tobacco free and smoke-free standards can be applied in all sorts of different ways. It can be applied to all the buildings owned or rented by an entity. So like it could be an entire hospital complex. It could be every health clinic in a network of health clinics serving tribal communities, but it also could be every building owned or rented by a tribe. Similarly, gaming facilities that are either owned or managed by tribal communities could go to totally commercial tobacco and smoke-free. And we've seen some examples of that. Mike could talk about this a little bit more, and I think Colin as well. And then for tribes that are ready for it, they could even set comprehensive standards for all businesses and public places on tribal land. So this would really be a comprehensive indoor smoke-free or commercial tobacco-free standard that would say if you're in a public area, in a workplace or a indoor public place, you will not be allowed to be using commercial tobacco or smoking or vaping on those premises. And that's really meant to protect third parties from smoke and protect people from being re-exposed to tobacco use if they are recovering from that and working on being commercial tobacco free in their lifestyles. The example of the image here is a smoke-free tribal housing policy. And we have seen interest from tribes in making sure that the housing that's provided by the tribe remains smoke-free and commercial tobacco-free, which is a really good way to protect other people in the housing and also prevents house fires, which is unfortunately a very common occurrence when people are smoking at home. Some standards to think about and the ways to set a strong smoke-free standard would be to define tobacco products broadly enough to include all commercial tobacco and definitely not include traditional tobacco. So you'd want to include all sorts of products that are sold under various trade names, but then you would also want to make sure that it does not apply to things that are being used for ceremonial or customary use pursuant to tradition. You would want to define smoking broadly to include vaping, using e-cigarettes, of course, and then also using marijuana in various ways. I mean, I think we're at a point now where we should acknowledge that kind of smoke is also going to be more prevalent in our lifestyles. And I know that in the Great Plains, not many states have gone the whole hog, but it does seem like it's coming. So tribes can think now about setting smoke-free standards that include marijuana as well as to commercial tobacco products. And then strong standards would include all indoor areas, require signs, and forbid ashtrays and butt receptacles in the areas where smoking is prohibited, really just so that people aren't being given a double message where they don't think they're allowed to smoke, but then they see an ashtray, which implies that they should be smoking. Also, really strong standards limit the outdoor areas where smoking may be allowed, either having a designated smoking area that's far away from these indoor areas or not allowing any designated smoking area and expecting people to use it elsewhere if they're going to use it. So I just sort of touched on these topics. As you can see in this still image, Mike and Colin have already given a great webinar on smoke-free casinos, and there's also one on Tobacco 21 on tribal lands. Both of these are available on our website. So if you're a glutton for webinars, then definitely feel free to click these links when you get this resource sent out to you later. Mike, I see that you have made yourself visible. Do you have any thoughts about these webinars you'd like to share?
Yeah, if people are interested, they should watch them. I would be interested in letting people know that I do own another shirt, though. I just happen to be wearing the same one.
Noted, noted. Yes. And you may have been in a different room at the time too, but still, why mess with excellence, Mike? Mess with excellence. But yeah, those resources are great. And as a result of them having done this webinar last year, Colin and Mike can answer any questions you have about smoke-free. The second policy I wanted to talk about is tobacco retailer licensing. So a tobacco retail license makes enforcing sales restrictions way more effective. You know who is selling the products, and you can revoke the license without if they violate your rules. So a license is a privilege and not a right. And instead of having to go to court and get an injunction and do all this extra work, you can stop them from selling the products just by revoking the license, which is just a very strong enforcement mechanism. It works much better than fines in terms of sending a message to the retailers that they should stop doing whatever it was that violated the tribe's rule. Also, once you have a tobacco retail license, you can cap the number of licenses. You could forbid licenses for certain types of businesses. So like pharmacies or liquor stores, maybe you don't want those places selling tobacco products for whatever reason. And you could also limit where tobacco retailers could locate. So you could keep them further away from housing. You could keep them away from schools where they tend to target advertisements at young people. There's just a lot of really good tools that you can access once there's a tobacco retail license. Also, along with the license, you would normally collect a fee. So the system pays for itself. By having a tobacco retail license, you charge the retailers enough that the government has the sufficient funds to have the staff to do inspections and administer the program. So it's really nifty in that respect. So once you have licensing, you can have sales restrictions that are really effective. So this is very similar to what I was talking about, where the tribes acted quickly to prohibit the sale of e-cigarettes. Those tribes who also have a retail license will have a really effective tool for enforcing that policy. So you can prohibit the sale of flavored tobacco products, for example, flavored cigars, as we have a picture here, or menthol cigarettes. E-cigarettes, of course, are frequently flavored. You can prohibit the sale of cheap or small products by setting minimum prices or minimum pack sizes. Many jurisdictions require at least 20 little cigars to be sold together, and they require a minimum price for that product as well, sort of making it hard for young people to justify starting the habit. You can prohibit any sales that include discounts or coupon redemption, thus keeping the prices high and sort of undercutting the tobacco industry's main source of marketing. And then you can do what the tribes did in 2019 and prohibit an entire class of products. So prohibit all of the e-cigarettes or what have you, prohibit smokeless tobacco if there's a very big problem with that regionally or geographically. And then also the last one is prohibiting sales where it's very easy for young people to access products they shouldn't. So requiring in-person face-to-face sales and prohibiting things like vending machines or online sales. All of those are possible and usually much easier to implement when you have a tobacco retail license. So the third type of policy that I wanted to talk about is just sort of the broad powers that tribes have that go far beyond what other jurisdictions can do. So tribes have significant legal powers that they can express in new and unique ways. Largely they have very strong authority over environmental regulation within their borders and sometimes within the treaty territory. Tribes are not preempted by the main federal law, the Tobacco Control Act that was passed in 2009. They are not prohibited the same way that states and localities are. So they really have a broad set of policy options that goes beyond any other level of government. And so for an example of this, I'd like to talk about a few things here in Minnesota. For example, in 2005, the White Earth Nation prohibited the growing of genetically modified wild rice or manoomin. This is the first policy of its kind, and I think maybe the only policy of its kind, across the continent, and sent a very strong message that they were going to protect Manoomin, even in the face of industry efforts to change the rice and to make it into a different commercialized product. More recently, in 2019, White Earth and the 1855 Treaty Authority passed laws establishing the legal rights of Manoomin. So now Manoomin has a right to exist that goes beyond any right that a human has, and can be protected in tribal court. And more recently, a few months ago, White Earth actually sued the state of Minnesota in tribal court for violating the rights of Manoomin. So I mean, it really opens up these new ways of thinking about tribal resources and tribal culture in exciting ways. And though I haven't seen it yet for tobacco and traditional tobacco and protecting it the same way as Manoomin, I think it's worth mentioning that commercial tobacco was one of the first genetically modified organisms in the world. They started genetically modifying it in the 1990s. And especially with climate change coming, it might be useful to protect traditional plants like traditional tobacco and other plants that are used in these traditions, and even protect the ecosystems that they come from, using things like the rights of nature and the inherent authority of tribal governments over such a thing. Yeah, so I'm going to switch to our third topic real quick here. And this is talking about what the Public Health Law Center can provide in terms of legal technical assistance, the resources that we have available right now. So you'll see at the bottom of this page, there's a link to our tribal commercial tobacco control page. And I just excerpted three publications that Mike put a lot of work into that feature on that page, including doing tribal tax policy, doing federal tobacco 21, and smoke-free tribal casino policies. And these are all really useful documents that sort of talk holistically about the issues and why it might be attractive to a tribe to do policy in these areas. I think that they're really, really useful resources for getting the conversation started. At the Public Health Law Center, what we do is we give legal technical assistance. So that includes things like this training, this presentation. It includes the publications that I just showed you. And it includes things like doing specific legal research that's germane to what you guys want to talk about, and also helping you develop policies, implement policies, and defend those policies if they're challenged. So, I mean, there's just lots of examples, and I think Colin and Mike can talk about this a lot too, where tribes have come to the Public Health Law Center and they want to do something unique. They want to set up a policy that doesn't really have a pre-existing example out there, but they want to do something in terms of smoke-free, or they want to do something in terms of a sales restriction. And we're very happy to help with the policy development and talk about the pros and cons of different choices being made in developing say a smoke-free casinos policy or something like that. We have a lot of already made publications that might be useful. I'll show you a couple more photos of those. But we're very excited to do sort of the personalized assistance for the types of questions that you have about your community and what would work best for you. So just broadly speaking and showing off our other publication about drafting tribal public health laws and policies, I want to re-acknowledge that we recognize that working with tribal communities requires tailored policies that meets folks where they are. We don't believe in one size fits all. And we're very excited about getting to sort of use the lessons and the sort of ways of working that we've had from experience with other tribal communities in helping to work with you as well. In addition to everything I've been talking about, which is in the commercial tobacco side of our office, I also want to point out that that's not all the Public Health Law Center does. We also have a healthy eating and active living team that is very active in helping people work on policies to do with daycare, food policies, breastfeeding in public places, physical health and the access to parks and things like that. So they really focus on things within the healthy food area, creating safe streets and parks for people to play in. So places where we can recreate safely. And then, and there's a big focus across all of our teams on promoting health equity in all policies. So we really want to make sure that there's full participation of communities in the policies that govern their lives. Sorry, there's a pretty loud truck in the background here. I hope you guys can hear me all right. Okay, and with that, I just wanted to just highlight some of my great colleagues who have already talked about a bit here. Mike and Colin are here and can introduce themselves. And I'm just gonna say, so the director of our Healthy Eating Active Living team is named Julie Ralston-Aoki. And she's also definitely happy to talk to you if you have any questions about healthy eating, active living stuff. But for right now, I would love it if Mike and then Colin could introduce yourselves and maybe talk about the work you've done both at the Public Health Law Center and otherwise working with tribal communities. And perhaps we'll get some questions to answer as well.
I guess I can go with that, Colin, if you want. Then you can go after me. So I'm Mike Freiberg. I'm a senior staff attorney with the Public Health Law Center. I've worked at the center since 2006, dating back to when we were just known as the Tobacco Law Center. So it's an honor to be here. This is an area where I kind of try to recognize my limitations. I'm not a tribal member. May not always be the right person to work on some of these policies, but there have been some instances where I've been honored to be invited to work on some issues with commercial tobacco-free policies with tribes and so forth. So, it's again, I'm honored to do this work when asked, but don't, if I'm not the right person, that's fine too. So I'm happy to be here. If anyone has any questions, about the materials Hudson talked about or just anything going forward, feel free to reach out to me.
And I'm Colin Welker, a policy analyst on our commercial tobacco team. Also nice to be here and see some familiar names online. I've been at the Public Health Law Center just over a year, and prior to that, I was at the American Indian Cancer Foundation. Nice to see Misha on here, so hello. And I worked on policy there as well as some clinical stuff. So I've worked a little bit with the Great Plains Tribal Chairman's Health Board before. And prior to that, I worked for the Sault Ste. Marie tribe of Chippewa in Michigan for 4 years working on tobacco policy there. So happy to help in any way we can. One thing too, that if you need help with research, we're happy to help do that to back up policies. I know that can be daunting for some folks, so happy to help in that way too.
All right, so that is it for the slideshow, but I would be thrilled if we could have a discussion, or if folks wanted to submit any questions they have about our services or policies they could pursue. Yeah, what's on everyone's mind? And Sean might have some great ideas too.
Yeah, I agree. I think that great. Thank you, Hudson, Mike, Colin. So happy to have you guys here with us. I think that was a great little presentation. I think it'll be wonderful to be able to send that out to everybody so they can view those links at their leisure, as well as some of the other links that we've included in the chat. It's a lot of information. Does anybody have any questions right now? Anything pertaining to maybe any of the 3 topics that Hudson brought up today? Or anything. It doesn't have to be anything that we spoke about today. If there's any questions that you have with the Public Health Law Center and how they can assist your tribal organization or tribal community, or just community in general, now would be a great time. We can talk about that discussion, or like I say, I'll be providing everybody's contact information. And so if it's something that you would rather do on a one-to-one basis, you'll have access to all of these gentlemen. after the fact. Oh, good. Here's a question. I don't know if you see it, Hudson, on your
Yep.
screen. I can read it out.
Yeah,
So,
read it out.
yep, I'll read it out. So, what would be the first step to starting smoke-free policies? For example, having a smoke-free casino. What is needed right away to get that started?
Colin, you might be a good person to tackle this one first.
Yeah, I was thinking, I guess what in my experience, you need a champion, someone who is willing to take on the cause. And I think that's your biggest biggest need, I think, to get started, is someone to advocate for that. And then I guess one thing I found successful, and not to plug Clinton, but he's on here as well, I saw, and he's done a lot of work in this area. So he maybe can type in or chime in. But I think a coalition is a great way to start too, bringing people together from different departments in the tribe, not just the casino and the health department, but bringing different folks and stakeholders at the table to address that thing. But I think just finding a champion. And now, I mean, that webinar Hudson plugged, during COVID, we've seen a lot of casinos going smoke-free to protect workers and patrons alike. So we're in a unique time where a lot of tribes are making that decision to go smoke-free and then stay smoke-free, which is really exciting. So no time like the present, I guess, to get going on that.
Right, I love that. I was just at Ray's. Ray did a tribal tobacco advocacy toolkit training just earlier this week, and she talks about how bringing the community together and finding what their needs are. So it's just like you're saying, Colin, getting those people that are really, they have personal stories about how this is affecting their life to the negative, and rallying together for that common cause, I think, is so powerful. So I'm really glad you said that. That's nice. Any other great questions? And again, I'll plug Ray's toolkit again, because it's such a great product, and it's meant to be utilized across the board and customized to your particular community. But I inputted her toolkit, findyourpowersd.com, in the chat, and you can look that up. Also in the chat, we just put in is for the community health webinar, our survey. It'll take you 2 minutes if you want to complete the survey, so we can talk about how you found it helpful. But any other questions?
Well, I guess I would just want to say, on behalf of all of us at Public Health Law Center, we're super stoked that we got to talk to you all today. Mike and Colin and Julie and our colleague Natalie all are very, very interested in helping out as much as we can with Great Plains tribes. And I think Mike has something else to add there.
I did actually see another question come in on the chat from an
Excellent.
anonymous attendee asking how important is data for starting the policy work. And I guess I'd say it's very important, and to the extent you can get like locally specific or tribe specific data, that's going to make things a lot easier and build support for a policy, whether you're talking about a smoke-free, if you're talking about a smoke-free casino policy, surveying the employees of the casino, finding the extent to which they view secondhand commercial tobacco smoke as a health hazard is helpful. If you're talking about tobacco-free schools policy, finding the extent to which tobacco use or e-cigarette use within those schools can be very helpful as well. Or counting, it can be even like counting up tobacco waste to finding out to find out what a problem it is in your community. And that sort of data can both build political support for a policy, but it can also, it can also go into the policy itself. A lot of ordinances and laws passed at the by tribal councils have findings in them, and it can talk about how that commercial tobacco product is an issue in the community.
Yeah, to Mike's point, we found with tobacco product waste that doing collections at schools and getting the data of what is ending up either confiscated or littered at schools is really compelling. We've seen in numerous jurisdictions that strong policies were justified by the fact that young people were ending up with these products and they were ending up costing schools a lot of money to dispose of correctly. So gathering that information not only provides useful data, but it involves parents and students and educators who may, as Sean said at the beginning, they might not realize what a big problem it is until they start working together to count that stuff. So definitely in the waste side, data is very important, and it can be used as sort of a way to bring new people on board to the issue. I think, like the CDC data on the Valley included hospitalizations and deaths. And obviously those are very stark figures, but there's great ways to gather data in the community that falls short of something that shocking.
Right. Yeah, I think the more creative that data picture is and more specific it is to your community, I think the more beneficial it can be, even if it isn't the best, quote unquote data out there. But yeah, really getting it to make it specific to your community, that's imperative. And I think on another point, just with everything that we're talking about here today, and having you folks here from the Public Health Law Center, having those connections and those, a coalition or a team, those collaborations are really what I think help push these values and these missions to the next level. The more hands, the stronger we are. And I think, as kind of always, since COVID has been kind of a theme, we're much better together and stronger together. And the more that we can build upon each other's strengths, and create that strong chain, the more power we can have, and the better we can do for our communities. Any other questions for these fine folks? Oh, here's I think that's Casey, I think, put in the chat. South Dakota South Dakota Tobacco Control Program does offer grant work to help gather data and create coalitions and work towards those smoke-free policies. So like I say, there's always connections out there. Thank you. Okay, well, I think if that's it, we'll go ahead and close our presentation.